So how often and how much exercise someone should do is an important issue. First of all, I would start by saying that the more exercise someone does, it will be better, not only in terms of diabetes, but also in terms of other aspects such as cardiovascular health, pulmonary health, and effects on blood pressure. So if a person has not exercised in a very long time, they should start very slowly, preferably daily, but if it cannot be done daily, at least 3 times a day. So start slowly and as tolerated. 5 or 10 minutes in the beginning would be important. Now, the key thing is that exercise should be increased over time as tolerated. Most of the significant effects of exercise on diabetes and cardiovascular health occur when people exercise at least 3 times per week. When they exercise between 30 and 45 minutes. So those are the recommendations if someone wants to obtain the beneficial effects of exercise on diabetes and cardiovascular health. Again, one is to start slowly. So any exercise is good, but it's important to note that it is beneficial to increase it to a certain target. So if someone exercises 3 times a week for 30 or 45 minutes, that will be very beneficial. If they can exercise more days a week and for a more prolonged period of time, it will be even more beneficial. How intense the exercise should be, again, one should start as tolerated and increase proportionally to an exercise that will cause that person to break out a significant sweat. That is what is recommended. There are other ways to target or to dose the amount of exercise, and one way is using a formula of the maximal heart rate, in which one deducts the age from 220. So if someone is 60 years old and one deducts 220, that the maximal heart rate for that person is 160 beats per minute. So typically we start a program at 50% of the maximal heart rate, so that person would exercise, will do exercise that will lead their body or their heart to beat 80 times per minute, because it's 50% of 160 is 80. And then as that person increases the exercise intensity, one can increase the heart rate to 50 or 60 or 70% of the maximal heart rate.